You're listening to the Public Health Epidemiology Careers Podcast, episode 114.
Welcome to the Public Health Epidemiology Careers Podcast, where we explore public health epidemiology careers and share tips and strategies to help you enter or transition into the field. And now, your host, Dr. Charlotte Hughes Huntley.
Greetings, everyone, and thank you for joining me on this episode. In today's episode, you're going to meet Dr. Moaz Abeldelwadoud. He is an international public health researcher, and he has an impressive background. I'm going to tell you a bit more about his background, and then I'll connect the interview. Now, Dr. Moaz Abeldelwadoud is a postdoctoral fellow in the Pharmaceutical Health Services Research Department at the University of Maryland School of Pharmacy. Now, right after earning his medical degree from Ain Shams University in Cairo, Egypt, Dr. Abdelwadoud began his public health career in 2007 at Theodore Bihraz Research Institute. I may have mispronounced that, but TBRI in Egypt. He worked on prevention and control of liver and kidney disease with special focus on viral hepatitis. Now, during his appointment at TBRI, he earned his first MPH in preventive community medicine with a capstone entitled Development of Emergency Room Patient Record in TBRI Hospital. Now, at the same time, he worked as a health program specialist at the Center for Development Services in Egypt, assisting in monitoring and evaluation of internationally funded reproductive health, sexuality, and HIV/AIDS projects. The Egyptian Ministry of Health delegated him in 2011 to coordinate a medical convoy and conduct a health needs assessment for asylum seekers who were stranded at the Egyptian-Libyan border, and then appointed him as the chief of Egyptian surgical convoy to Burundi in June of 2012. Now, following these missions, he was selected to participate in the Inter-Academy Partnership for Health Young Physician Leaders Program, held in conjunction with the World Health Summit in Berlin, Germany in 2012, and the World Health Organization Assembly in Geneva, Switzerland in 2016. Now, Dr. Abdelwadoud was awarded in 2012 the Netherlands Fellowship to participate in the 49th MPH International Course in Health Development organized by the Royal Tropical Institute and the Free University of Amsterdam, the Netherlands. His MPH thesis sought to identify and address key factors that influence access to hepatitis C interferon-based therapy in Egypt via investigation of different health systems, policies, strategies, and best practices to inform Egypt's treatment and prevention strategy. In 2014, Dr. Abdelwadoud joined the University of Kentucky DrPH program and worked on the research project Access to Hepatitis C Treatment in Kentucky. He developed his doctoral capstone project through his research investigating different barriers to hepatitis C treatment after referral to University of Kentucky Outpatient Clinic. In 2017, he completed his DrPH degree and 2 graduate certificates in global health and college teaching and learning. During the academic year of 2017-2018, he served as adjunct faculty at the University of Kentucky College of Public Health. He assisted and led the following undergraduate courses: Introduction to Public Health, Global Health, and Foundations of Health Behavior. He co-instructed public health capstone courses for MPH health management and policy students, in addition to advising some of them as a committee member. Now, at the University of Maryland School of Pharmacy, Dr. Abdelwadoud is working on the Patients program, as well as other projects that are funded by the National Institutes of Health, FDA, and other federal and state agencies, foundations, and private corporations. Now, before I connect that interview with Dr. Abdelwadoud, I'd like to share a special announcement. This episode is brought to you by LinkedIn Learning. Building and enhancing skills that are complementary to your public health education can be a powerful combination. It can help you become more competitive in the job market as a public health consultant and as a business owner. LinkedIn Learning is offering our listeners access to their extensive library of resources free for 30 days. You can start now, access anywhere and anytime. Just visit drchuntley.com and click on the Resources tab from the main menu. You'll find the link there to access your free trial. All right, well, today I am excited to introduce you to my special guest, Dr. Moaz Abeldelwadoud. So, Dr. Moaz, as you're commonly referred to, welcome to the podcast.
Thank you so much. Thanks for inviting me. Thanks for giving me this opportunity to participate with you in this podcast, and hopefully it will be useful to public health professionals and public health community at large. Thank you.
Oh, absolutely. It will definitely be a big hit for sure, because I have already reviewed some of the notes and I know about you from your profile on LinkedIn, and I'm just really excited to dig in and start the interview. So if you don't mind, let's just start with you telling the audience a little bit about yourself. I read your bio and talked about you in the introduction, but just, in your own words, just tell the audience a little bit about yourself.
So my name is Moaz Abeldelwadoud. I'm a Postdoctoral Research Fellow with the Patients Program at University of Maryland School of Pharmacy. So this is my short introduction about myself. So now I am in Baltimore, Maryland, and I'm doing public health research from the perspective of the community. So in the Patients Program, we listen to local communities in order to co-develop with these communities healthcare research. So from the research point of view, we are doing public health. Most of our work, actually, it's about community engagement in healthcare research, healthcare delivery, and access to health services. So this is my focus now, and this is building on my public health experience in different contexts, in Egypt and in Africa, in the Middle East at large, and in Europe and in the United States.
And that's great, because our audience, the people who listen to the podcast, it's a very diverse and global audience. So we have people listening from literally around the world. And I think that there's a lot of power that comes when you can bring that global perspective to your work. So when you say that you are doing the community research, or the research that you're conducting, is it within the community in Maryland?
Okay, so this is a very good question. Actually, the Patients Program started with West Baltimore because this is our catchment area and we are the state public university, and this is our catchment area, West Baltimore. But with the growth of the Patients Program, now we are working even at national level. So we are expanding outside Maryland, but our focus actually is West Baltimore, but we are expanding. We have different collaborators from different states all across the United States, and even we have a variety of our interests in community engagement from different perspectives. So I would say over the last 5 years, the Patients Program is growing, not just for Maryland, but for everywhere in the United States.
Okay, that's great. So that's definitely an indication that it's very effective and it's having a positive impact.
Yep, this is correct, because actually our impact is about our approach. So we can call ourselves, we are disease agnostic. We are not focusing on a specific locality or specific disease or health problem, but we are focusing on our approach, which is community engagement in research and conducting patient-centered outcome research. So our approach is listening to local communities and co-developing with these local communities health research which is meaningful for them. So this is our main vision and how we envision patient-centered outcome research and community engagement in research, which is all under the umbrella of public health.
That's really interesting. So I'm going to ask you a question about sort of your background, because you are a medical doctor.
Yep.
You have a DrPH and you have an MPH.
This is correct.
So how do you think that your background has really prepared you for the work that you're doing now?
This is a really good question. And usually I ask myself this question: why I'm here in Baltimore, Maryland, after all this journey? I would say my professional and academic experience is kind of diverse, and this is actually one of my lucky things in my life. So I have public health experience as a student and as a professional and as a researcher in multiple contexts in Middle East, Africa, Europe, and in the United States in a different location, which was in Kentucky, where I did my Doctor of Public Health and Health Management and Policy. And I think this kind of variety of experiences prepared me for my current research position at the University of Maryland. Because in the patients program, as I just said, we don't have actually skies. So we are saying that we are engaging local communities. We are working with different types of partners. Most of our partners, actually, they are coming from the local communities, like churches, like working with community non-governmental organizations, working with housing authorities, working with different types of people. I would say my background helped me to be flexible and to listen to people. I mean, people like my co-workers, my partners, and our target communities. And this is actually something that I feel helped me very well. If you have this kind of experience, which is diverse experience, you can fit in very easily with any type of public health work, either it's research or public health services or public health outreach. So I'd say my diversity of experiences that I have, this helped me a lot actually in working with people like our department and our patients program. It's very diverse backgrounds, racial backgrounds, everything. And gender background, everything. So even our local communities, they are diverse. And within the local communities, there are sub-diversities that you need to understand and to make sure that you understand these diversities. So I think this has actually helped me a lot. My experiences helped me to fit in with the patients program and hopefully my next step in my career.
Oh, yes, I can definitely relate to that. I spent many years living in the Washington, D.C. area, and I actually lived in Baltimore for a couple of years. And one of the things I remember about living so close to Washington, D.C. is that people are from everywhere else. I mean, no one's really originally from DC. There's so many people who are from everywhere else around the world that is this rich mixture. And like you said, even like this rich mixture in the area of people from all sorts of, ethnic, racial, groups. And then even within those like sort of subpopulations, you've got this this mixture. So it's like a mixture and then a subsection of another really mixed, diverse population. So you've got a diverse population within a diverse population. So I definitely can understand how your global experience can be very valuable where you are.
Yeah, this is perfectly correct. Thanks.
So what population or condition or like what public health problem would you say you're most passionate about?
Yeah, this is a really good question. And I think every public health professional should ask himself or herself this question. What's my passion? So I'd say my passion is about serving marginalized and disadvantaged population everywhere. So this is why I have these kind of diverse experiences. But I would say my particular interest revolves around health services research, especially equitable access to quality health services and engaging disadvantaged population in health care and health services research. So I'd say this is my passion, access to quality health services, equitable access, based on health equity principles. And regarding my topic of interest or health problem of interest, my primary passion has been access to hepatitis C services with all around hepatitis C, how people can contract hepatitis C, modes of transmission, a lot of stigma about injection drug use, and even the local stigma. People who are saying, okay, these people with this kind of disease, this is related to RST behavior, which can be stigmatized in some communities. So this is my specific interest. For a long time, in master's degree, in my doctorate degree, I was focusing on access to hepatitis C services. And now I'm currently broadening my scope to include other infectious and non-infectious diseases. As I said, we here in the patients program, we are disease agnostic. So I'm working in different types of projects which are related to different types of health problems.
That's really interesting. I recently completed an interview with Miss Delda Robertson. So that episode, now that may have already published by the time this one comes out or it's coming up. So you guys have to search for that in the podcast titles. But she also does a lot of work or has done a lot of work with hepatitis C in public health settings and was talking a little bit with me about that as well. So very important work and a lot of big changes in terms of treatment for hepatitis C over the years. So still a lot of work to be done, but there's been a lot of changes, lots of great improvements. So
Yep, this is correct. Yeah.
So I'm going to shift a little bit and ask you a question about, ask you to share some advice. And I know from your background, especially with having from the clinical side with a medical degree and then the public health, that's such a great combination because you have that full understanding of the one-on-one patient care and treatment and interaction and importance, and then the population-based treatment importance and prevention. And that's a really powerful combination. With all that you've done, I know you'll have some great advice. So people who listen to the podcast, we have got a lot of public health students who are, they may be at the very beginning of their education, or they may be, about ready to graduate, but for public health students who are, working on their degree and learning about public health and, in hopes of having a career in public health, do you have any advice or tips that you can share with them?
Yeah, actually, I would say the first advice I'd say for everyone working in the public health field or studying public health, keep public health your passion. You should be interested in what you are doing. Public health is not like 9 to 5 daily work, activities, routine work. Public health should be your passion. And this is the first thing. Think about this. Keep your interest up all times, whatever the challenges you face, to make a change at population level, which is not easy. This is why you need a passion. I would say my second advice, when you work in public health, your public health work intersects with all social determinants of health, which means you need to collaborate with people from other backgrounds, different disciplines, and now the multidisciplinary approach for public health work and public health research is growing. You cannot do your work on your own because you are working on different social determinants of population health. So you need to work with people from different sectors other than the health sector or public health sector. You need to work with people working on transportation. You may work with people who are working on housing, work with people working on environment. So you have to be open to this, and you have to make sure that you can interact with these people and collaborate with them. And I would say my third advice, develop your area of niche. This will not happen just after graduation. It takes time. So when you start by saying, okay, during my public health studies, I think I'm more close into health behavior and working on health behavior. This is great. And this is a wide discipline. Later on, you may focus on specific topic. Think about what is the approach that you would like to follow in health behavior. What are the tools that you would like to want to use? What are your target communities? So area of niche is something important in public health career, but comes gradually over time with your experiences, training, and working with different people from different backgrounds.
Oh, that's amazing. That's great advice. I absolutely agree with you. When you mentioned finding your passion for public health, I talk about that all the time. And I like the way you give the example of, this is not your typical kind of 9 to 5 type of work. You have to be passionate about what you're doing. And that is what drives you. So, decide, and it kind of goes with the other, finding your niche, but be passionate about the population you serve, the cause that you're advocating for, the research that you're into, because it really is so much more than a 9 to 5. And then I also like the way you say, collaborate with other people from different backgrounds. That is one of the ways that you can really help sort of check your passion, because when you work with people in other backgrounds, and you mentioned like transportation, for example, it keeps you in a position where you always have to explain, or you may have to constantly explain what you do, or not so much teaching like your job title, but explaining what public health means and what the implications are in transportation, and learning about the environment and whatever the issue is within the transportation industry. And it keeps you, really keeps everything really fresh. It keeps like you said, your interest up. You're constantly learning. And once you are exposed to these various areas, you really can start to develop a niche. So excellent advice. I love that.
Thank you so much. Thank you. And following on this, I would say you should be a public health advocate. I mean, you are advocating for public health. Sometimes when you work with these people from different sectors, you need actually to tell them what you are doing, like for transportation, is improving people's health. Or how can you make your transportation or work on transportation help people improve their health? So I would say if you have this passion and working with different people from different sectors, you are advocating for public health and you are helping to improve public health in direct and indirect ways.
Oh, absolutely. I may have to pull some of that out to tweet and share on social media. You had lots of great quotes in there.
Oh, thank you so much. Thank you.
Now, I'm going to ask you sort of the same question. I need some advice and some tips because I have also a group of my audience who has already completed their degree in public health, and they may be facing some challenges trying to get into the career field, but they already have their degree, whether it's whatever, a bachelor's or master's or doctorate level. They're just trying to either get started or transition from one field into another. But what tips can you share with someone who fits that category?
I would say the job market rules, you should listen to these rules. Some of the major challenges that I myself found, and even some of my students at University of Kentucky, how to find my best match, which is matching my interest, matching my abilities. I would say sometimes you need to be flexible with the job market and join a team that works in different interest or approach. And I would say it's all public health. If you have a degree in public health, you can do epidemiology, you can do health services research, you can do health behavior work, you can work in environmental health. I would say join the team, keep yourself with the flow, open your mind, you will learn from any experience you will have in public health. For example, one of my students, she just finished her Bachelor of Public Health and she was speaking about environmental health. And she was interested in environmental health, but she couldn't find what she was looking for. But she found a great opportunity with an NGO which is working on improving health behaviors or risky behaviors for teenagers. And she started this work. With time, she became interested in that and started to link this to her interest in public health. I would say keep yourself with the job market, be open to different types of organizations. It's all public health. With time, you may find a new interest and you find a new match for yourself. So I think this is something important because public health, it has two sides. Public health is a very interesting field. We have different sub-disciplines within public health and a lot of people working in public health with different entities like research entities, professional organizations, and governmental organizations, boot on the ground organizations, grassroots organizations. Be open to these different types of organizations. I would say something important in my career that helped me in my position now that I work with different types of organizations from different perspectives. And finally, I found myself, okay, I'm now interested in health services research, access to health services, but my work in health behavior and working with non-governmental organizations, working in reproductive health, helped me think comprehensively about the problem of access to health services and different perspectives of different types of populations. So I would say be open, experience yourself with different types of organizations and different disciplines of public health. You will learn something.
That's powerful. And that's great because I know that sometimes people can get a little frustrated. They maybe had their mind set on one particular thing that they wanted to do. And if it doesn't happen right away, they feel defeated. But, being flexible and, being more open because the field is broad there, you could be very fulfilled in a slightly different area. And I think it's almost get stuck on the job title itself, looking a certain way and have to understand that, maybe move that title aside and look at the actual work that you'll be able to do and what you can learn once you get into a role if you just be a little flexible.
Yeah, I would say strategic thinking about your career should be not just, I just finished my degree, I want to work now on what I would like to do. I would say some of my colleagues and some of my students thought very strategically about their career. Some of them were thinking, okay, I finished my Bachelor of Public Health, let me work in the field for 5-6 years, then go back and earn a Master of Public Health, which can help me improve or maybe consolidate from the academic perspective my experience over 5 or 6 years. So these people, I like how they think about it. Some people say, okay, let me go now and work with non-governmental organizations, gain this kind of fieldwork experience, and later on, I may join the academic environment and work in academia. So I would say be flexible, be strategic, think about your public health career over all your lifespan, make it like stages in your life, in public health career life, experience yourself with different types of organizations in different contexts, and gain these experiences even from different disciplines of public health. And finally, you will see yourself changing, you will see yourself improving and growing with public health.
That's great. And you are speaking my language because I'm always talking about strategic thinking. I actually spent quite a bit of time over the summer refining a program specifically for students and teaching them about thinking strategically, even about the questions that they ask regarding the careers, and the options and the opportunities. And I've been really coaching this particular group of graduates who are trying to get into the field with strategic thinking. Like you said, that, be really intentional about your next step. So we're definitely on the same page with that. That's great. Great advice.
Thank you.
Well, I really appreciate you taking the time and speaking with me and sharing all of this with our audience. I know that it will be well appreciated by many people. And you've also shared your connection information. So I will provide that on the show notes page for this episode. So if anyone's listening and you really like what Dr. Moaz is talking about and you'd like to connect with him, then just visit the show notes page for this episode and you'll be able to find all of the information to connect. And I'll give that information to you in just a few moments. But for right now, I just wanted to say thank you again, Dr. Moaz, for being here and being my guest on the podcast.
Oh, thanks for your invitation. Thanks for giving me this opportunity to speak about public health, my passion, and what I need other people to know from my perspective and from my experience. Thank you so much.
You're very welcome. Well, I do hope you enjoyed that interview. I'd like to thank Dr. Abdelwadoud for joining me on this episode to discuss his public health career journey and for sharing such great advice and tips. If you'd like to connect with him, then just visit the show notes page for this episode, which is episode 114. So visit drchuntley.com, and that's drchhuntley.com. Click on podcast from the main menu and then navigate to episode 114. You'll find all the links to connect with Dr. Abdelwadoud. Remember that you can also click on the resources tab from the main menu and you'll find the link to start your free trial of LinkedIn Learning. All right, everyone. Until next time, have a fantastic rest of your day.
Thank you for listening to the Public Health Epidemiology Careers Podcast at drchuntley.com.